Good evening, colleagues. Good evening. Good evening. Thank you for joining us again. This is our second session in our webinar series. We thank you so much for joining us. We will officially hand over to our moderator for the afternoon in just 1 second. But in an effort to have everybody have their brains prepared, we started off on Monday with a little brain teaser. We have another one today. So I am going to be sharing my screen for just a short while. Now, for the persons who have joined us over on YouTube, this goes for you as well. And for those who are joining, others will continue to join. I am sharing with you. So our brain teaser today, to get us into the right frame of mind, will be this crossword puzzle. And we will be setting the timer, and we're going to be asking you, you have, should you get a minute or two? Anybody would like 2 minutes? Hands? No? All right, let's get the time started. We're going to give you 2 minutes. And what we're going to ask you to do is when you find the words, you don't need to circle it, just tick it off or write it down. And then maybe you want to put a little mark to say, where did you find it? Because you're going to have to put in the chat when the time is done. How many did you find? And then later on, we may have to contact you to show us where you found it. So the instructions are, again, we're giving you 2 minutes. Look at the puzzle. The words are at the bottom. When you find the word, write it down and make a quick tick, and then just make a little notation of where you found it. So when we contact the person who found most of the words, you'll be able to have your evidence to collect your prize. All right, so ready, set, go. 2 minutes have started.
And although the mother is from here, did you contact Canvas about
All right, time is up, pencils down, no cheating, pencils down. So the second part of the instructions, please write in the chat, how many of the words did you find? Don't write the words, write the number. There are 5, 9, 12, 15 words. So write how many of the 15 did you find? And then keep your evidence because we'll be contacting you when we've checked in the chat to see how many you have found. Those of us on YouTube, same applies to you. Go into your chat. Please remember to write your names, put the amount, that's the number of the words you found from the screen. Your little notation, we'll be contacting you as we go throughout the session. Thank you so much for joining us again. And let me now unshare my screen and officially hand over. Our moderator for today will be our own Melissa Walker. She was our counselor before, and she's now a part of our publicity and newsletter committee. Ms. Walker, I hand over to you.
Thank you, Madam President. Good afternoon and welcome, welcome, welcome. Welcome to all our chapter members. Welcome to those thinking of becoming members. Welcome to our supporters and welcome to all students who might be joining us. My name is Melissa Walker and I will be your moderator for today. This is our second session in this infection control webinar series. We were off with a bang on Monday with the topics microorganisms and multi-drug resistant organisms, and what a wonderful session it was. If you were not able to join us on Monday and you would like to watch the presentations, you may find the recording on YouTube by searching for Omega Kappa Infection Control webinar series. If you are joining us on YouTube today, please remember when you sign in to place your full name in the chat so we can have a record of your attendance. Today, we have two other very relevant and interesting topics: isolation and precaution, and hand and body hygiene. Before I introduce our first speaker, let me remind you of our platform etiquette. We will take both presentations and then facilitate the questions and answer segment. If you are in the Zoom room, please remember to keep your mics closed until the questions and answer segment, where you will be acknowledged after you raise your hand using the raise hand icon. For our participants joining us via YouTube, please place your questions in the chat and our monitor on that side will ensure that the questions are relayed during the questions and answer segment so that they can be fully addressed. We have two competent presenters today. Our first topic for this afternoon session is isolation and precaution and will be presented by my esteemed colleague, Mrs. Margaret Waite. Mrs. Waite is a lecturer and program coordinator for the Masters of Science in Nursing Education at the UWI School of Nursing, Mona. She holds the following degrees and certifications. From the UWI School of Nursing, Mona, in 2010, she did a BSc post-RN with gaining first-class honors. And in 2016, she did a Master's of Science in Nursing Education. She has also done a certificate in supervisory management, and she got this from the Mona School of Business and Management, and she has also gained certification in emergency room nursing. Mrs. Waite has been a registered nurse for more than 20 years, having gained her certificate in general nursing from the Kingston School of Nursing. She obtained clinical experience from the University Hospital of the West Indies, where she worked as charge nurse in the accident and emergency room, the Natal Memorial Hospital, and the Spanish Town Hospital. Her research interests include nursing leadership and the just culture. She is passionate about the welfare of nurses and is a strong proponent of self-care. Ladies and gentlemen all, please help me welcome Mrs. Waite, our first presenter.
Thank you so very much, Ms. Walker, Melissa, and good afternoon to everyone. I trust that you have all had a good day and you're looking forward to the weekend. But before we start enjoying the weekend, thank you so much for joining us today. And so I will be presenting on isolation precautions, as was mentioned by Ms. Walker. So if you'll allow me to share my screen, I will get right into it. Okay. One moment, please. I will just go to slideshow and I will start. Okay, if you're all seeing my screens, I will continue. So today, I said before, we'll be looking at isolation precautions. And in the usual spirit, I usually would have talking objectives, but today I'm going to be having talking points because we have been taught about this from nursing school. And so we are going to be discussing today. You'll be hearing me talking most of the time, but you will have the opportunity to ask questions in the question and answer section that will come up at the end of the discussions. And so today we are going to be focusing on definition of key terms, the classifications of these precautions, protective equipment that will be required for each of the precautions as classified, as well as the procedure, which is very important for donning and doffing PPE, which is putting your PPE on and taking them off. So the very first definition we are going to be talking about today has to do with standard precautions. And according to the CDC in 2017, standard precautions are those minimum infection prevention practices that will apply to all patient care, regardless of suspected or confirmed infection status of the patient in any setting where healthcare is delivered. So it doesn't matter whether or not the patient has a confirmed diagnosis of a particular infection, even if you're suspicious that the patient has this particular infection or there's any suspicion whatsoever, then you need to engage with standard precautions. Another part of the definition states that it includes infection control practices and the use of personal protective equipment, commonly called the PPE, when having contact with all patients, regardless of patient diagnoses or presumed infection status. So I'll encourage you to engage in utilizing standard precautions when you are engaging in the clinical practice setting with all patients. Standard precautions will apply to handling blood and any other body fluid, secretions, excretions, regardless of whether they contain visible blood. So don't think that because it does not contain blood, it's not going to be infectious, and so you don't need to apply standard precautions. So blood, all blood, body fluids, secretions, excretions, whether or not they contain visible blood, non-intact skin, which we commonly call broken skin, as well as when you're coming in contact with mucous membranes. Now let's quickly look at the elements of standard precautions. And this is not new to us as nurses because we would have been engaging with this once you would have passed through a curriculum related to nursing and you're in the practice environment. But as we're going to be talking about precautions today, it is important that we be reminded of them. So we are going to be looking at hand hygiene, and we are going to get into a little bit more detail about hand hygiene and all the other elements as displayed on this slide. So hand hygiene is any action of hygienic hand antiseptics in order to reduce transient microbial flora, which is generally performed either by using hand rub with a alcohol-based formulation or hand sanitizer, which should contain at least 60% of the alcohol, or by engaging in hand washing with plain or antimicrobial soap and water. And this is not my saying, this is coming from the World Health Organization. We are also going to be looking at sharps safety, respiratory hygiene, and cough etiquette. This is not anything new to us either. We would have been socialized with this as children. We were taught about it some more in nursing school. And as you continue to practice in the clinical environment, you are being reminded about respiratory hygiene and cough etiquette. And you also need to ensure that you are teaching, you're educating your patients about these as well. We'll also be looking at use of personal protective equipment, and I've only listed a few of them. This is by no means the extensive or exhaustive list. We're going to be talking about gloves, masks, eyewear, and the list goes on. Also, a part of the elements of standard precautions, we are going to just mention here, safe injection practices. And this is the aseptic technique that you would utilize as clinicians when you are dealing with parenteral medication for your patients and clients. Now, globally, thousands of people will die each day from infections acquired while they're receiving health care. The hands are the main pathways of germ transmission during healthcare delivery. Hand hygiene is therefore the most important measure that we can use to avoid the transmission of harmful germs and to prevent healthcare associated infection. The World Health Organization in this particular diagram is reminding us of those 5 moments of hand hygiene in the practice environment. And I'm going to pause here just to get a little bit more into what these 5 moments will include and what they mean. And just to remind us too, that the use of gloves does not replace the need for hand hygiene. Be reminded that the use of gloves does not prevent you from practicing your hand hygiene, and it should never replace practicing hand hygiene. So the very first moment that we want to talk about is before patient contact. And why do we need to practice hand hygiene before we make contact with our patients? This is to protect the patient against colonization and in some cases against exogenous infection by harmful germs carried on our hands, because we do have germs that we carry on our hand from day to day. Even if you engage in rigorous hand washing, there are going to be some resident pathogens there. And some of, just to remind us of some of those times before patient contact, as stipulated by the first item there, before we shake hands, before we touch our patients, whether it's just to, use a therapeutic touch, before assisting the patient with their activities of daily living, and before delivering care, whether or not we are, including an invasive technique. So some of these non-invasive techniques can also include, and we're applying oxygen masks, for example, for our patients. So be reminded that you need to practice hand hygiene before you do these things. And this is the number one thing they're speaking about here, before patient contact. The second one you'll see on the slide says before aseptic tasks. And this includes before practicing your dressing change for your patients or your clients, before preparing medication and serving medications for your patients, before handling pharmaceutical products for your patients and your clients, and before inserting any invasive devices such as your nasal cannula, your nasogastric tube, etc. So be reminded you have to perform hand hygiene before you engage in aseptic tasks. Now, the third one is saying after handling body fluid. It says after body fluid exposure risk. So if you are in the practice environment and you are coming in contact with any body fluid whatsoever, or you suspect that in your procedure you may come in contact with body fluid, you have to ensure that you practice hand hygiene there. I know many times you're in the clinical setting and you are rushing to do things, but please be mindful. Remind yourself of these moments. Number 3, after body fluid exposure risk. The fourth one speaks to after patient contact. So you would have done it before your patient contact. You're also reminded to practice it after coming in contact with your patient. So before you do anything else, after you've completed your task with the patient, you engage in hand hygiene before you move to anything else. And then the fifth one has to do with after contact with the patient's surroundings. And I'm sure that if you should think through in your mind and to remind yourselves of the number of times you would have been holding on to the patient's IV pole, holding on to the bed rails while you're speaking with the patient, you would have been coming in contact with items in the patient's surroundings. So you are also reminded that you should practice hand hygiene after coming in contact with the patient's surroundings. So a quick reminder: before patient contact, before aseptic tasks, after body fluid exposure, after patient contact, and after coming in contact with the patient surrounding, and those elements in the patient surroundings. And this particular slide can be found on the World Health Organization's website. There's a bunch of and a world of resources that you can find there that will assist you in reminding yourselves of these moments. The World Health Organization also has this visual chart that says how you should wash your hands. And I'm not so sure if we need to get into it today, but I'm going to be reminding you that here are the things that you need to do in your hand washing. And it's even more so important now. We are in a pandemic. It has been a year. We're still in the pandemic. We don't know when we're going to see the end of this pandemic, and we are being reminded to continue to wash our hands. We have to be careful. The basic thing of washing your hands is important. So you will ensure that you have the appropriate equipment that you will need to wash your hands. And if there are healthcare administrators in here, I'd like to use the opportunity to remind them that provision of these items are important for the staff members to utilize in completing their hand washing as required. So you would, first of all, wet your hands with the water, apply enough soap to cover the hands, and recommendations are anywhere between 2 to 5 mils of the soap. And you rub your palms together rigorously. Then be reminded that the back of the hands also need to be washed. So you use one hand to rub the back of the hand, interlacing the fingers, and then you do the same for the other hands. Then you come back to the palm of the hands and interlace the fingers again and rub them together. You can see the visual there. And then the fifth step, or the sixth step rather, is that you be reminded that the back of the fingers are also very important. And then you rub the fingers in the opposing palms. Then the thumbs are always sticking out. They are very important. Be reminded that they are part of your hands and you need to wash them. And so the thumbs should never be forgotten. So you use you rub the left thumb in the clasp palm of the right hand, and you do the same for the opposite side. Be reminded that the fingertips are also important, so you rub them in the palm of your hand in a rotational brisk movement. And then this is not here, but I'm using the opportunity to remind you that your wrists are also a part of your hand washing, and don't forget those as well. So you'd rub the wrist, and then you would rinse your hand with the running water, dry your hands thoroughly, use single piece of tissue for each hand, or the paper towel rather for each hand. We have moved past the use of towels and reusing towels among members of staff. So administrators, I'm encouraging you to ensure that the staff members have the paper towel to use. And then you use a paper towel to turn the tap off. It's important too that if you are an administrator and you're engaging in part of the decision making as it relates to equipment required in a new setting, that you encourage the hospital administrators or the facilities administrators to install those that are, sensitive to movement, and they will automatically turn on, or the ones that you can use your foot for pedaling and you turn those on and off. But if you are in a practice setting that already has, pipes installed, and you have to turn them on using the flip lid, or, to twist them on and off, that you use a piece of paper towel to turn the faucet off. Your hands are dry, and now they are safe, and you're safe to proceed with the next patient or the next procedure, or to sit and document your notes, etc. All right, so that was it for hand washing. Then we move to hand rub. We are all engaging in hand rub, hand sanitizer since the pandemic. It's even more so now since this pandemic. So the World Health Organization also has this pictorial here, which represents the steps that you need to take. They're encouraging us to use at least 30 seconds to engage in the hand rub. And as I mentioned before, the 60% alcohol should be contained within that hand sanitization formulation. So you apply to the palm of your hands and you rub all surfaces. You rub your palms together. It's similar to what you would do in hand washing, except that it's a little bit less time that you're going to be using. And remember, then you move on after you would have done your, is there someone marking on the screen? So you'd move on to your procedure, or to do whatever you have to do once your hands are dry. And may I use this opportunity to discourage clinicians here that if you're using hand sanitizer, you allow them to dry by themselves. You do not use paper towel or any other, you do not use paper towel, tissue, rags, or whatever to remove the hand sanitizer. Allow it to dry. It goes through the process. Allow it to dry, and now your hands are safe to use. All right. So the next one element that we're going to speak about is sharps safety. This is very important as part of your standard precautions. Healthcare workers are frequently exposed to percutaneous injuries with contaminated sharps, which can be prevented. A lot of what injuries we face, they can be prevented if we know how to use our sharps containers appropriately, if we know how to handle sharps when we are in the clinical setting. Just want to remind you too that when you are through with your sharps, especially your needles, you do not recap them. You do not recap your needles. It's important. If you are going to recap the needle for some reason, ensure that it is in a puncture-proof container, and you do the scoop method. You do not hold the cap while you are trying to recap the sharps. And on the slide, you will also notice that I do have two containers. One that has the sharps to about 3/4 full. That is what is encouraged, to 3/4 full, not the entire way to the top of the sharps container. Ensure, as administrators, I'm encouraging you, if you're in hearing of my voice, remind your staff members to ensure that they do not fill the sharps container to the very top. It's dangerous, and it can create injuries to the users of the sharps containers. So I have here, avoid unnecessary injections if you have to. We can, as nurses, we can advocate for other routes for medication. Not every patient will require injection. If it is not necessary, we can advocate for another route. So avoid injections. Safely manage your sharps waste. This includes collecting the contaminated sharps immediately after use without recapping the needle, and I spoke about that just now. And use puncture-proof sharps container. There are manufactured sharps container that your facility can purchase for you. I do know that there are some facilities who may be trying to save money. The budget may not be that large, that extensive for them to purchase, and they create their own. Ensure that they are using ones that are puncture-proof and leak-proof. Use engineering controls such as auto-disposal syringes. If your facility can afford to buy those, I'd encourage them to buy them. Needle-free devices are also encouraged, and the retractable or sheathed needles are also most suitable to use. So if you can move away from the capped needles or the devices that require needles, and you can purchase those, ensure that those are purchased. If they are purchased for the facility, ensure that the staff are aware how to use them and that they use them appropriately. I am not certain what is happening here. Okay, I thought my slide just froze. And so the next element of the standard precaution that we are going to be speaking about is respiratory hygiene and cough etiquette. And like I said in the introduction, this is not new to us. This is not new to us as individuals. Growing up, your parents would have taught you this, your grandparents, or whoever whoever was charged with raising you. You would have also learned this in school. You'd have also learned this in nursing school, but it's also important to be reminded. And we can also use the information to remind our patients, to educate our patients and family and visitors to your facility, especially during the flu season, and especially now in our pandemic, to remind them about cough etiquette in particular. So they are reminded to cover nose and mouth with a tissue when coughing or sneezing. If a tissue is used, it's disposed of immediately after it's used in an appropriate receptacle. It's not thrown on the ground, it's not thrown all over the place. It's disposed of in an appropriate container. And you perform hand hygiene, whether hand washing, alcohol-based hand sanitizer, after you would have contact with respiratory secretion and contaminated objects and materials. Use the opportunity if you can make posters, download posters, print them, laminate them, put them at the entrance to your facility or your wards or unit to remind your visitors, to remind the patients about cough etiquette. One of the things I also want to mention here is that if you don't have tissue, or the patients don't have tissue, that they can sneeze into their bent elbow or the upper part of their sleeve, but not in their hands. All right. So encourage patients while they're sitting and waiting to come for visiting, they can glance at your notice board and they will see these instructions that you would have posted there. And I'm sure they will appreciate it as reminders. This is a graphic that came to us from the CDC, and it spoke to what I was just referring to. Cover your cough, stop the spread of germs that can make you and others sick. So it is encouraging us to cover our mouth and nose with a tissue when we're coughing or sneezing, and you put the used tissue in the waste basket, like I said before, the nearest receptacle. If you don't have a tissue, you cough or you sneeze into your upper sleeve or elbow, not in your hands. And then you wash your hands immediately after or sanitize immediately after. And for those patients that will require further protection, you can ask the patient to put on a face mask. You may provide one for your patient and encourage them to use it. Now we are going to be moving to personal protective equipment. And like I said before, this is not something that is new to us as healthcare professionals. We know what PPE are. These are wearable equipment designed to protect from exposure or contact with infectious agents. So they are used at particular times. They are used as needed to protect skin, clothing, mucous membranes. And these include, and as like I said before, this is not the entirety in terms of the list of personal protective equipment, includes gloves, face masks, protective eyewear, face shields, protective clothing, which can be your reusable or your disposable gowns. We are familiar with all of these. We just spoke about standard precautions. Now we are going to look at transmission-based precautions, and you may know them in different categories as contact precaution, airborne precautions, as well as droplet precautions. These may be terms you've been hearing since the pandemic started, and we'll continue to hear them and be reminded of them as we move through this pandemic. And even beyond the pandemic, we have to be reminded because there are new diseases, there are re-emerging diseases, so we have to continue to be careful. Now, for transmission-based precautions, the CDC in 2019 defined these as infection control measures in addition to the standard precautions that are needed to prevent transmission of highly transmissible or epidemiologically important infectious agents. So as you can see here, you are just reminded about the standard precautions. If you're engaging with clients who will require transmission-based precautions, these are required in addition to the standard precautions that we just spoke about. Transmission-based precautions are also designed for patients who are known or suspected to be infected with these pathogens and will require additional control measures to prevent transmission. So this, in essence, is saying that your standard precautions by themselves will not be able to help to prevent the transmission. You will require additional control measures. And this is when you're going to be employing now your transmission-based precautions. PAHO in 2017 also indicated that transmission-based precautions are those additional precautions which will apply only to those patients in whom there is a suspicion or confirmation of a particular infection, especially if it is in its infectious period or colonization. All right, so be reminded that even if you're suspicious that this client has this particular infection, or if it is confirmed, you are to engage the transmission-based precautions as well as your standard precautions. As mentioned before, transmission-based precautions will include contact precautions, droplet precautions, and airborne infection isolation precautions, or you could just say the airborne precautions, but you will see it referred to as airborne infection isolation precautions in several literature pieces. So use more than one rather set of precautions for diseases that have multiple routes of transmission. So for those diseases that may be transmitted by several means, you have to use more than one set of precautions. So you will use your standard precautions, and you may use your contact precautions and your droplet, or you may use the standard precautions, your contact and airborne, etc. So they may be used in combination. When they are used either singularly or in combination, they should always be used in addition to your standard precautions. So your standard precautions will play a part in your transmission-based precautions when you utilize them for your patients who are being deemed suspected or confirmed to have particular diseases. Now, contact precautions, there is direct and indirect infection. So this is direct is the infection that passes from the reservoir to the susceptible person without any mediating additional elements in the transmission. So there's nothing between the reservoir and the susceptible individual. So that's your direct infection. As well, the CDC mentioned that there's indirect, which is infection that is transferred from through an intermediary that can be of environmental, which they classify as inanimate, or healthcare worker or another patient, which are animated. So you may indirectly transfer infection by touching, handling inanimate objects in the clinical environment, in your patient's surroundings, etc. Or you may be transmitted through one healthcare worker or patient to you. So be mindful of that. So take all precautions necessary. We're going to be focusing now on contact precautions. And these will be applied to patients who are infected or suspected to be infected with medication-resistant infection. And Dr. White was so thorough in his presentation on Monday speaking about medication resistant disorders and diseases. We have here two examples, MRSA and Klebsiella pneumoniae. Then there are diarrheal infection or infection of unknown origin that may be caused by the norovirus or the rotavirus. There's eye infection such as conjunctivitis. So be reminded that the pink eye, we call it the pink eye, that too will require you to engage in contact precaution measures. Then there are skin infections like impetigo, shingles, and chickenpox. And if you notice, I have asterisk shingles and chickenpox because these will also require that you use airborne precautions as well. And remember, I spoke earlier about using more than one set of these precautions. Here is the prime example. If your patient is suspected or confirmed to have shingles or chickenpox, you should need to engage with your contact precautions, airborne precaution, in addition to your standard precautions. All right, so your standard precautions, your day-to-day. And when you have patients who are suspected to or be confirmed with a particular disease, then you will select the precaution that is most suitable. For those of you who are in the clinical area and you have to admit your clients to the units, for those patients who will require contact precautions, you place patients who will require this precaution in single rooms when they are available. Don't walk away from here today to say Mrs. Wade says that patients who require contact precautions, that they must place them in single rooms. That's not what I'm saying. If the rooms are available, then you utilize them. And we know how our bed space and bed situation here in Jamaica can be at times. And especially for those hospitals that have been built for quite some time and they do not have the single rooms available, you will not have that available to you. If this is not possible, then you place together in the same room the patients who are infected or colonized with the same pathogen and are suitable roommates. And this is called cohorting your patients. So if you have patients who are of similar disease infection, then you can cohort them if they are suitable roommates. If your patient is not stable and will not be able to remain in that room and you need to be in and out of the room and be doing many things for the patient, this client can't be deemed as being a suitable roommate for the other patients. So he or she would not be placed in this particular setting. All right. Avoid placing patients on contact precaution in the same room with patients who have conditions that may increase the risk of adverse outcomes from the infection or that may facilitate transmission. And this can be, for example, your immunocompromised patients, those who have open wounds or have anticipated prolonged length of stay. So your assessment is very important. And I know I'm preaching to those who already know this. And this was verified by the CDC in their writings in 2019. Ensure that patients are, if you are cohorting patients though, ensure that they are physically separated at least 3 feet, but more than 3 feet from each other. And when you are cohorting patients in the same area, in the same cubicle, in the same room, use a privacy screen between the beds to minimize the opportunity for direct contact. So once you would have used a privacy screen, it helps to minimize the patients reaching over to the other patients, etc., etc. All right. So once a privacy screen is there, utilize it, and you space your patients 3 or more feet apart from each other, or 1 meter for those of you metric. Now we spoke about the contact, we're going to talk about the droplet transmission and the precautions. Droplet transmission takes place when the droplets from an infected person makes direct contact with the conjunctiva of the eyes or the mucous membrane of the nose and mouth of another person. So you see people walking around and they're coughing, they're not utilizing the cough etiquette. They're just coughing openly, not covering their mouth and nose, and these droplets can move directly to you. I want to share my experience here quickly. This is how I, at age 27, was able to, no, I wouldn't say was able to, was infected with chickenpox when a client coughed on me when I was doing his blood pressure. And it was after seeing the doctor, etc., that he was diagnosed with chickenpox. So just be mindful that this can happen. So take the necessary precautions for those clients who are coughing and sneezing. So use the droplet precautions for patients known or suspected to be infected with pathogens transmitted by respiratory droplets that are generated by the patient who is coughing, sneezing, and talking. And you know, Jamaicans, we like to talk and talk loud and talk up in each other's face and touch you and hold you and talk to you, right? So be mindful. We are in a pandemic. And like I said before, even outside of the pandemic, we still need to be very careful. So droplet precautions are applied to the following diseases. This is not the extensive list. These are just some examples: influenza, meningococcal meningitis, adenovirus, those from rubella, mumps, coronaviruses, the SARS, and the MERS. For patient placement, you place a patient who will require droplet precautions in the single room when they're available, if they're available. When single patient rooms are not available, you cohort the patients who are infected with the same pathogens and they are suitable roommates, as I said before, for the contact precautions. You avoid placing patients on droplet precaution in the same room with patients who have conditions that may increase the risk of adverse outcomes from infections or that may facilitate transmission, like your immunocompromised patients. You may not want to place them in this room with the other patients, even though they may require droplet precaution measures. Ensure that your patients are physically separated if you're cohorting them, that they're separated from each other at least 3 feet. Use a privacy curtain between the beds to minimize the opportunity for close contact. And it is recommended that you change your PPE and perform your hand hygiene between contacts with patients, even though they're in the same room, regardless of whether one or both patients are on droplet precaution. That is very important to note. We're going to move quickly into airborne transmission, and this involves very small droplet particles which can remain in the air for much longer and travel further than the droplets before being inhaled. So even if the person is away from you at a distance and they cough or sneeze and talk loudly and the sputum or the droplets move at a further distance, yes, and you walk within that environment, you are inhaling it. And these particles or droplet nuclei are less than 5 microns in diameter. So that is why we are not going to be talking about a little bit later about wearing your mask and your face shields or goggles, etc. You will use airborne precautions for patients known or suspected to be infected with infectious agents transmitted person to person via the airborne route. And that is very clear. These are some examples for patients with infections such as pulmonary tuberculosis, varicella, measles, SARS, or those patients for whom aerosol generating procedures are going to be required. You have to take your airborne precautions seriously for these clients. For placing your patients or rooming your patients, you place them in the airborne infection isolation room, or the AIIR, that has been constructed in accordance to guidelines. And this should have direct exhaust of air to the outside of the room. Now, we do know that many of our hospitals here in Jamaica have been constructed for quite some time now, and so they may not have this. However, if it is not possible to exhaust the air from the AII room directly to the outside, then the air must be returned through HEPA filters to the air handling system, which is going to be exclusively serving that particular isolation room. All right. But as administrators, if you are here, you can be a part of the committee that is going to be planning the blueprint for some of our newer facilities. Use the opportunity also to speak about, the importance of having these airborne infection isolation room, even in your emergency area and on your different units, because as we see, we are in a pandemic at this time. Many of our institutions may not have had this, and so they had to do a lot of reconstruction, refiguring, etc. So the way forward is to ensure that we have this, because once we have these kind of diseases where there's no turning back, we are going to have more. And we may just have more pandemics. It's not a matter of when, it is a matter of if, it's a matter of when. All right, so be reminded of those as well. So keep the room door closed for when you're just entering and exiting the room. So should not be left open. So you will use it when you're going in and when you're coming out, and it's kept closed. When a private room is not available, or in the event of an outbreak or exposure where large numbers of patients will require the airborne isolation precautions, consult your infection control personnel. And I'm very happy to note that we do have these in our major hospitals and health facilities. And so these are persons who are resource individuals. You seek their consults, you seek their information, and then you would they will help you to make the decision in terms of rooming and cohorting patients. Don't do this alone. So just to quickly talk about the PPE that is going to be required for each of the groups that I just spoke about. For contact precautions, you will use a clean disposable glove when you're entering the room, and you remove it when you exit the room. You will require also a clean gown, non-sterile. You use it when you enter the room, and you remove it before you exit the room. So there should be provisions made for receptacles inside of the room and outside of the room, or inside the area and just outside of the area, for the staff members that will require to dispose of them, and dispose of them appropriately in the right containers. For the droplet precautions, a mask is going to be required, and you don the mask upon entry to the room. You mask the patients if they're going to be transported to have any procedure done. And it's important to note also that try to minimize transporting the patient. If it's at all possible, have those services come to the patient, like your ECG and your portable x-rays, ultrasounds, etc., rather than moving the patient to and from. You'll also require clean disposable gloves and a clean non-sterile gown. For the airborne precaution, you'll need an N95 mask or a higher grade of mask, or your face filtering piece, such as a FFP3, you'll require a higher grade. And these should be fitted for you. They're not all the same. They should be fitted for the individual. You've done these prior to entry to the area, and you remove them after you have left the area, and they're disposed of according to your hospital's policy. You'll also require face shield or goggles, mask for the patients who will require transportation, and you'll require clean disposable glove or surgical glove if you are going to be engaging in surgical procedures or sterile procedures, and gown will require clean non-sterile gown. And as a footnote, these should be used in addition to the measures that were established for standard precautions, and be guided by the policies and procedures of your facility. Don't go there and tell them Mrs. Wade said in this presentation that this is what you should have. Be reminded that you are going to be bound by your policies, procedures, and guidelines of the institution to which you are employed. Now we are going to talk about something that we all know. We are going to be talking about PPE, and as you can see here on the slide, there are many different pieces of PPE. You'll have your mask, and there are varying kinds of masks, your gloves, your goggles, your face shield, and they also have that entire suit that you can also use, and those are used for specific purposes. Now, for donning your PPE, the standard thing is that you wash your hands before you do any procedure. You gather all your necessary items, and these are going to be dependent on the kind of precautions that you're going to be employing. So you gather the right equipment, you put your gown on first, and you secure it at the back. You tie it at the back at the neck, if that is what the gown is. If you're going to tie it at the back, like for example, this one that I have here is one that has ties to the back at the neck. The ties will come from the front, and you tie it at the back. And I'll encourage you to tie it in a bow, because it's going to be easier to remove. If you tie it in a tight knot, it's going to be difficult to release unless you have body system and there's another staff member there to help you to get out of your PPE. Once you've done your gown, then you put on your face protection, which can either be your mask, which could be a surgical mask, or you can also use an N95 mask. And remember, I said it needs to be fitted for you. You'll also employ your goggles or face shield as required. Then, if you are going to be using a head covering, this is the time to put it on. So you'd have put on your mask, your goggles, etc. You put your head covering on. You perform your hand hygiene, because as always, before you don your gloves, you perform hand hygiene. So you can use your hand sanitizer at this point. You don your gloves and ensure that the gloves fit over the sleeve of your gown. So once you would have done your gown, long sleeve, you put your mask on, ensure that the gloves cover the sleeve of your gown. All right. And I'm sure these are just reminders, because as we are in this pandemic, I'm sure your infection control personnel would have gone through this with you, as well as your charge nurse, your supervisors, etc. In removing the PPE, you are going to be removing your gloves first. It was put on last, you're going to be removing it first because it is considered the most contaminated of all of your PPE. This is the particular equipment that you would have been using to touch the patient, do whatever for the patient, touch the environment, etc. So you remove that first. If it is visibly soiled, it is recommended that you do some cleaning of the glove before you start to remove. If it is visibly soiled with body fluid, with blood, whatever it is. Then you will remove the glove by pinching the cuff. And I'm just going to put one hand of glove on quickly because I know time is going. You would have had the glove resting over the sleeve of the gown. So you're going to use fingers to just grasp the cuff of your glove and peel it off away from you, not pointing up in the air towards your face, but away from you. And you're removing the next glove, you are going to slip a finger under the cuff of that glove and peel it off into the other glove. Once you would have done that, if at all you suspect that your hands or the gloves became contaminated, or it contaminated your hand when you're removing it, please wash your hands. Be reminded though that the entire front portion is considered most contaminated. So if you had tied your gown to the front, you would have removed that tie or loosened that tie before you remove your glove. Now that you have tied to the back, you are going to remove your gown after you've removed your glove. So you reach behind you and you release that bow tie that you would have made. Allow the strings to open and fall to the side. Then you reach into, and you see how important it was to sanitize your hand if you thought that you would have contaminated your hand. You reach into, because you would have allowed the gown to fall forward, and you just reach into and remove the gown and roll it into a ball. Dispose of it in the required bin, in the required receptacle, whatever is provided by your healthcare facility, you dispose accordingly. Then you perform your hand hygiene with your sanitizer. If you had worn a head covering, this is the time to remove it and you grasp it from the top of your head, not from the front. The front portion of your body is now considered contaminated. So you grab it from the top, you remove it and dispose of it accordingly. Then you remove your goggles or face shield, whichever one you were wearing, by the straps. The face shield by the strap at the top of your head, dispose of it in the right receptacle, especially since it's may need to be recycled. If you are wearing a mask that has these loops, then you grab them by the loop. You never hold on to the front of your mask and you dispose. If you wore the N95, you grab the straps, allow them to fall to the front without holding on to the face mask at the front. You allow them to fall one at a time. You grab the last one and dispose of your mask accordingly. Then you wash your hands. Wash your hands. Realize I did not say hand sanitize or perform. I specifically have here, wash your hands and you dispose of it, all the equipment according to your facility's policy. Be reminded you need to know your policies and procedures. And here is a diagrammatic representation of what the World Health Organization and the CDC recommends, and you may find these on their websites. And at this time, I'd like to thank you all for being such rapt attention. If you have questions or comments, you may do so at the appropriate time after the next presentation. There will be a question and answer segment. Thank you all so very much for listening.
Thank you very much, Mrs. Waite, for that very comprehensive presentation. I would like to apologize to our participants. I know they individuals on YouTube, I was being made aware that the persons on YouTube were having some challenges at the start, so they might have missed a portion of the presentation at the beginning. I trust they are now all in. And at the end, some participants, they were saying the volume is low. I am going to apologize again for that. I will encourage you when the presentation is finished and it has been placed on YouTube, perhaps you can go re-engage again, just so that you can hear those portions of the presentations that you might have missed. But just to give a brief recap, and it is very brief, not going to any details, Mrs. Waite reminded us of the elements of standard precautions and of course the transmission precautions. And within the standard precautions, elements of standard precautions, she reminded us about the 5 moments of hand hygiene, and I will just name 2 of them, such as before contact with the patient and after contact with your patient or any body fluid. And she reminded us of the procedures for hand washing and those critical actions that you are to take when you are washing your hands, the procedure for the hand rub, when to use the hand rub, and what are some of the critical areas that you are to focus on when using the hand rub, and of course, what is to be used, what is the appropriate solution formula to be used for the hand rub. She also went through the sharps safety. And of course, one of the main takeaway points I would say is ensuring that if you are not using a standard sharp safety receptacle, that you are using something that is leak proof and puncture proof resistant. And of course, in the respiratory hygiene and cough etiquette, covering nose and mouth when coughing or sneezing. Do not cough or sneeze in your hands. And of course, a lot of this would have been reinforced over time, us having been in COVID now for almost a year. And to remember that if there is no tissue, we can use the elbow, we can use our elbow, and we would have seen that quite a bit in a lot of the presentations that we might have had over the media, etc. And she went through the transmission precautions, focusing on the various areas, the contact precaution, droplet, airborne precautions, and what all of those mean and how we are to be carrying out those various standard precautions. And then, of course, finally, she went through PPE. What are the various equipment that form part of the PPE and how they are to be used? As Mrs. Waite indicated, you might have some questions. I'm just going to ask you to place your questions in the chat, whether it is you're on YouTube or in the Zoom room. And of course, my facilitators who are assisting me will ensure that we get the questions at the appropriate time. So we are going to move on to our second presentation as we thank Mrs. Waite again for a very comprehensive presentation. Our second presentation is going to be on hand and body hygiene, and this is going to be done by my other esteemed colleague, Miss Carleen Simpson. Now, Miss Carleen Simpson currently holds the title of Assistant Lecturer at the UWI School of Nursing, Mona. She has over 20 years of experience in nursing, with most of that time spent in the areas of ICU and emergency room nursing. She is certified in nursing. She's a certified nursing administrator, having done a master's in that program, and she has a passion for professionalism. And one of her many visions is to inspire individuals in all sectors of nursing towards the best standards of clinical management and applying them as a force to bring about positive change. And I would say that sounds quite excellent for a vision, Miss Simpson. And of course, she is quite apt and prepared to present to us the next presentation on hand and body hygiene. Miss Simpson, thank you for agreeing to do this presentation, and I now hand over to you.
Good afternoon, Ms. Walker. Good afternoon, colleague. Thank you all for coming. I don't know about the esteemed part, but I will take it. Okay, so let me just go right into my presentation as not to waste any time. While Mrs. Waite was there speaking, I was thinking to myself, if somebody looked at the initial part of Mrs. Waite's presentation and looked at my presentation, they probably thought we sat down and did it together. Because for a moment there, I was a little bit worried that she was going to do all of my presentation with every single content that I had. However, she branched off in her expertise, so thank you, Mrs. Waite. So I'm trying to share my slide. Okay, let me see where I can find it. There we, I hope you all are able to see my slide. Can somebody just indicate to me able to see the slide, please?
Not yet. We're not seeing it just yet. But it does indicate that you are attempting to share screen.
To share.
Mhm.
So my,
Yes, it's up now. You may put your slideshow.
Ms. Walker, how do I switch to slideshow? Oh, I'm seeing it now. However, if I switch to slideshow, I will not be able to see any of you as it is going to overwhelm the entire presentation, but let me go ahead. Okay, there we go. I hope my presentation is not as huge on your end as I'm seeing it from my end. Anyway, ladies and gentlemen, let me first say I will give hygiene particular event. And I know workers probably are tired of hearing about hand hygiene, washing your hands, using sanitizer, standard precautions, airdrop spread, contamination, and the information is so overwhelming sometimes. But take heart, we need to do this, especially if we want to, as healthcare workers, especially if we would like to see COVID or dissipate it to a great extent. And I'm sure protecting yourselves, your families, and your patients, and of course your colleagues, it's all worth it. So let me move on. So I'm just doing an overview. So I'll be looking at, we can advocate more for good hand hygiene, and of course, the seriousness of healthcare associated infections due to suboptimal hand hygiene practices. And I'll be looking at some of the different tasks. Mrs. Waite went in depth with hand washing with soap and water, but I'm going to look at two other techniques that we have used, and to a certain extent and depending on the situation is effective if done as per the principles. And then of course, we're just going to glance on the 5 moments of hand hygiene approach according to WHO. And of course, we'll look briefly at health promotion and self-care nurses and our body hygiene as nurses, because that too can contribute to our general health, cross-contamination, and the spread of very, very communicable diseases. And I must say, we here at Sigma, if you are a Sigma member, if you have never gone into the Sigma website and looked at researches with regards to hand hygiene practices, precautionary care, do so. There is a wealth of information there, and it speaks to the commitment to enforcing, educating, and advocating for initiatives to improve our hygiene practices in our healthcare institutions, so we can reduce some of these healthcare associated infections. So what is hand hygiene? In WHO definition, I'll be giving the definition from the Northern Ireland Public Health Agency. I love that institution. And when I compare the WHO and Northern Ireland Public Health Agency and also Registered Nurses Association of Ontario, whose best practice guidelines we use in our undergrad program and in our postgrad program as well, are very much similar. However, Northern Ireland Public Health Agency states that hand hygiene includes cleaning hands with soap and water or alcohol-based hand rub in order to remove germs, also known as microorganisms. So, especially in this time of the pandemic, optimal hand and body hygiene cannot be emphasized any more, or I would say it can be emphasized. WHO also stated that they rolled out a global hand hygiene approach initiative in 2005.
Ms. Simpson?
And they improved upon it with an extension in 2009. And as I go along, I'll be showing you those. And they have cited that they have seen the effectiveness of proper hand hygiene techniques, the principles, implementing all of this in global healthcare settings. But even though the principles are there, the techniques and procedures are there, it has still.
Ms. Simpson, sorry to disturb you.
Showing.
Ms. Simpson, can you hear me?
Yes, ma'am.
Yes, we seem to be having a little bit of an internet challenge on your part. So what I'm going to ask you to do is to turn off your camera so that you will use less of the bandwidth, and perhaps we will hear you coming across a little better. And I'm going to ask you if you could just go back just from the beginning of this slide. I was trying to get your attention a little bit earlier, but I think you were not hearing me. I wasn't coming across. So if you could just turn off your camera so that you're not using up the feed, and then you can continue with the presentation. Please forgive me for disturbing you.
That's okay. Okay, stop video.
Yes.
And thank you, Ms. Walker.
Yes,
not
a problem.
Are you all hearing me better now?
We are hearing you much better now. If there is an issue, I will try to interject again.
Okay, thank you. So I was saying that with regard to what is hand hygiene, I was saying Mrs. Waite had already given her definition from WHO, but then I particularly compared 3 different institutions' definition. And this that I have on my screen is actually from the Northern Ireland Public Health Agency. And it basically says hand hygiene includes cleaning hands with soap and water or alcohol-based hand rubs in order to remove germs, also known as microorganisms. And these microorganisms have been known to cause really serious diseases, and we'll go into that a little bit.
Only that.
Okay. There is somebody whose feed is coming across, and it's rather disturbing from my side.
Hold a moment for me, Ms. Simpson. We are going to try to address the situation. Hold a moment, please.
Okay.
Can I ask Hernandez to silence her mic, please? Thank you. You may proceed, Ms. Simpson. Proceed, please. Apologies.
Okay. Ms. Walker, are you still seeing my PowerPoint presentation?
It has now reverted to the view version where we're seeing the main.
Okay.
Yes, so you can place it back on
from current.
Yes.
Okay, I'm going to put it back
on the slideshow. Yes.
From. Okay, so picking up from where I left off. So in healthcare, the use of effective hand hygiene practice to prevent, you will hear me say HCAIs, that's just health associated infections, and to reduce the spread of many common microbial resistant infections. And this practice has been going on for years, the practice of proper hand hygiene. However, compliance with hand hygiene practices, they have improved. There are still a lot of global incidences with regard to HCIs because it's still rampant and on large scale researches still are attributing infections with regards to cross-contamination attributed to poor hand hygiene practices. So I was looking more in depth at issues that may have been a factor for this, and what I came up with, because I compared various researches, there were several issues with regarding to how nurses and healthcare workers understand the importance of hand hygiene and going meticulously through each step. And so, for example, the importance of hygiene in reducing cross-contamination, they looked at where the technique itself was not adhered to step by step, the time frame in which nurses would practice or healthcare workers would practice hand hygiene procedures would not meet the time frame, or the technique was not done as per instructed. And this is based on certain issues. For example, nurses are always, these healthcare workers are always on the go. We are short staffed. And even sometimes these slips happen because of skill-based errors where it's more likely to happen, especially in clinical practices where the task becomes so familiar to us. And basically, we're thinking because we do it so often, we know it, and it requires little conscious thought, and that's when mistakes are made. So how many times nurses running from one patient to the other, and she washes her hand, however, not under a 45-second time frame. Did she go for the fingertips, the palms, the back of the hand, the interlacing? And so incorrect application of these principles of hand washing sometimes are breached, and the effectiveness of the procedure was not effective. So I'll be looking, before I go into that, one of those studies I looked at believed that healthcare providers was one of the professional groups have to practice hand hygiene. So in one study, they looked at food handlers, healthcare workers, construction workers, and I cannot remember right now who the other, I think it was a school. However, take a guess, anybody, as to what the hygiene compliance was among healthcare providers. One or two persons, somebody just tell me whether we are the blue, the purple, the green, the red. Anybody? Nobody? Okay, moving along.
Blue.
Red. Red.
Okay, somebody said red, somebody said blue. Okay, thank you. If you said green, you were correct. So hand hygiene compliance has been a problem among healthcare providers from as far back as Florence Nightingale days. And I have a little excerpt in one of my slides. And it was the first I was hearing that aspect about Florence Nightingale, but anyways. So that Canadian study showed, well, that particular study showed that it was a qualitative study done in Quebec, Canada, and as recent as 2019 by Atif et al. Of Quebec, and other studies like a formative research study was done among nurses in US hospitals, and this was done by a Professor Sands and Unger at the Arizona College of Medicine in the USA, and they basically backed up the statistics. Statistics might not have been really the same or number for number, but they were really close. And the study by Unger and Sands was done just last year. And they sort of attributed 55% was what they gave nurses. And they attributed that statistical data because we're in time of COVID. Nurses are on the front line always, 24 hours per day. Nurses made up majority of the sample, and so it came out at 55% in that study. So hygiene is of utmost importance, and it is well known. I don't think I need to cite this because it is a known fact, general knowledge, that proper hand hygiene is the most effective way to prevent the spread of diseases, especially through cross infections. So we deal this practice is undermine the proper use of hygiene practices because it is taking a toll on our healthcare system. It's taking a toll on our economy. And WHO, ladies and gentlemen, I think my slide is so big on this side that my references are not showing, but anyhow, WHO in a global survey stated that over 1.4 million people worldwide are suffering from infections that are acquired through healthcare, and improper hand hygiene was one of those factors that led to this figure. And especially in modern facilities, 5 to 10% of patients acquired infections. And of course, the percentages were a little bit more elevated in areas such as the morgue, the intensive care unit, emergency room, because those areas are really high acuity areas. And so the impact that healthcare associated infections can cause is very devastating. It can cause more serious illnesses for our patients and for us cannot leave the healthcare worker out at all. Excessive death, high financial burden, because in the event your patient or yourself picks up a disease because of cross infection due to improper hand hygiene, then prolonged hospital stay, medical consultation, sometimes you will develop complications that will lead you to go to a specialist, and you know the more specialized is the more costly. And of course, the probability of transmission to even your family members and to the community at large. So this gentleman developed an infection which was complicated, hence he lost his leg. So 5 stages of hand transmission for microorganisms. If you're taking, you can take it from various angles. What if it's germs present on the healthcare worker? I know I have patient skin here, and then you have immediate environment, contact with the immediate surfaces in the immediate environment, and then germ transfer to the healthcare worker to and of course your germs surviving for a period of time on that surface or on your hand. Somebody else comes and touches the same surface, might have contact with an individual directly. Of course, because of optimal hand hygiene, contamination of the hands is extended and transmission continues. So last year, during the initial and heightened and more upheaval part, WHO estimated that the burden of diseases and even alleged that it is possible that for hospital spread of the COVID virus, the probability that improper hand hygiene was one of the contributing factors was put out there. So healthcare facilities, again, it was impressed upon them to ensure that further training is done. Workshops are done. Health promotion with regarding to proper hand hygiene is done. More research is being done. Information is disseminated more frequently, and they were implementing that the constant our healthcare workers with the knowledge should have some effect, and that we will be seeing less cases of diseases that are caused by HCAIs. So we have discussed this. Why do we need to learn about hand hygiene practices? Because it is the most important initiative for preventing the spread of microorganisms that cause diseases. So hand hygiene is very helpful or very integral in reducing the number of germs one may carry on his or her hand, and in helping to reduce the germs on one's hands or person, then the likelihood of the spread will be diminished. So hand hygiene, WHO states that it is effective in reducing more than 90 or more than 90% of germs that are carried on the hand. And 70% HCAIs are preventable through proper hand hygiene techniques. So they emphasize that using appropriate hand hygiene prevents contamination to everybody. Who should practice hand hygiene? When I was looking at the presentation, I only saw this question: who should practice hand hygiene? And automatically in my head, I said everybody. So everyone, it is our responsibility as human beings to practice proper hand hygiene, especially us as healthcare providers. Everyone needs to practice this procedure with the hope of curtailing and preventing the spread of diseases, regardless of the work setting that we're in, but more so in our healthcare settings, because we work in areas that microorganisms are very prevalent. So Mrs. Waite made a point earlier where she stated that nurse administrators of healthcare institutions should ensure that their employees have the resources by which to work with. So basically, the Northern Ireland Public Health Agency is also iterating that statement, where hand hygiene should be practiced everywhere, in home, schools, outdoor businesses, more so in our healthcare institutions. Our healthcare institutions can get very busy, and hand hygiene products you find them going very quickly. However, our institutions, administrations need to be responsible with regards to ensuring that these products are always at arm's length for their workers, especially those who are in direct contact with patients and are working at the ground level. So ensuring, you all know that in Jamaica, sometimes we have a water shortage or a lock-off system. Sometimes you get so fed up, you go to work and them telling you no water or lock-off is scheduled for such and such a time. And so alcohol-based hand rubs are one of the other techniques, along with aseptic antimicrobial towelettes. It is recommended that they are utilized in the event that there is soilage on the hand and there is no water. Our administrators too are responsible for ensuring that there is a water source or what we call it, a backup water source in the event that there should be no water coming from our mains. And of course, the 5-moment of hand hygiene approach was also highlighted when I looked at those various studies. So Mrs. Waite already indicated and gave a detailed explanation as to. Ms. Walker, you're trying to get my attention?
No, I'm not. I'm
okay,
not.
So the 5-moment approach, one, before you touch the patient. And I looked at a research that stated that they're including number 1, before you touch the patient and before you touch the patient's surrounding. And number 2, and then the others went on as indicated on the slide. So I'll not be going over that again. It also described events and gave examples as to where each moment would come in. And I'm sure every nurse is very much aware of these moments where we should ensure we practice proper hand hygiene. Ms. Wade spoke about the hand washing technique using soap and water, mainly mild hypoallergenic antimicrobial soaps and a good water source. However, and Public Health Agency also spoke about 2, and it's the use of alcohol-based hand rubs or foams or gels, or what we call hand sanitizer, and another technique with the use of towelettes, which they recommend to be utilized when there is no direct water source. However, mind you, these other 2 techniques have their specific time and place to be used, because hand sanitizers are only to be used when there is no definite soilage on the hand and the hand is considered clean, as we might say. However, we might have come in contact with a patient or surfaces. We are not sure if there are microorganisms on our hands. So we ensure that we clean them properly to prevent possible spread. So as Mrs. Waite touched on hand washing, later on I will be sharing this link with you. It's the link from WHO that shows you a video recording of how to properly conduct a hand hygiene procedure. So they recommended when there is visible soilage on the hand, and even when there is not. I think even when there is not visible soilage, and water is the best technique for proper hand hygiene. through various steps. And of course, the alcohol-based hand rubs are what we call hand sanitizers. So this little excerpt here got my attention. Northern Ireland Public Health Agency was saying that alcohol-based hand rubs should be at least 60% ethyl alcohol or ethanol, which is equivalent to 120 proof. You know, when we talk about overproof rum, it's a property. So they said that to compare a bottle of vodka is 80% proof. So if you have no water and you might think that the vodka can wash your hand, it is not effective for proper hand hygiene because it is 40 proof shy of being adequate enough to clean your hand the way that is required for you not to be transmitting microorganisms. I thought that's a funny fact. So I said I was going to share it with you all. Okay. And for the hand rub, this particular technique, I am not sure as to the prevalence of usage here in Jamaica. I've seen it more being utilized on airlines. However, in the event we have like short water outages and there is no water, and of course, your hands are soiled, I personally would say not one towelette, two the least, one for each hand. And then if you are still uncertain as to how hands are, you can repeat the wiping with the towelettes again. And the wipe would, after wiping with the toilet, you follow up by doing the hand rub technique. So if your hands are soiled and there is no water, to remove visible solid from your hand or your skin, you would use a moist antiseptic antimicrobial towelette. And after you have cleaned your hands, just like how you would clean it when you're washing, you would add the hand rub to your hand and you would do the same technique as with the hand rub procedure. So until it's dry, so 20 to 30 seconds, and do not wipe off. Allow the hand sanitizer to dry on your hands because that is how it effectively kills any microorganisms that might be on your hand. So Mrs. Wade also spoke in depth with regards to the use of gloves, and that is no substitute for proper hand hygiene because there can also be breaks in your glove mechanism, even too with the unconscious effort that you put into paying attention when you have gloves on, especially surgical gloves, because I've seen my healthcare colleagues say that they don't need to wash their hand, they take the gloves off, they just need to sanitize, and then the sanitization technique don't even go as per principle either. So the use of gloves should not be an indicator as to the proper technique for performing your hand hygiene. So with that, I will leave that there. And WHO initiative that I mentioned before actually rolled out in 2009 a glove pyramid, and I like this pyramid. It tells you, according to the standard and the contact precautions that you are addressing, whether you need to use gloves, sterile gloves or non-sterile gloves, what situations will require direct contact or not. And so I'll also be posting the link as well. I will be directing you to where you are able to retrieve all of these resources. So speaking about hand hygiene, also need to look at other aspects of skincare for the in washing your hands, sanitizing your hands so often. Sometimes skin gets dry, and if it's dry or too dry, sometimes we'll with cracked skin. So Long Island Public Health Agency also impressed upon healthcare workers, especially nurses, that hands should be moisturized regularly. It is advised to carry your own personal tube of approved hand cream, and where individuals do not have their own personalized hand cream, then just as how the healthcare facility provides the hand sanitizer, soap, and the water, they should also provide approved hand creams for healthcare workers to utilize. When we develop cracks and breaks and our skin, it becomes exposed to those microorganisms. It can become a colonization, and then the probability of easier, faster transmission will occur. So in the event that we have skin lesions, as a healthcare worker, if you do have a skin problem, whether skin lesion or chronic skin condition, because I've seen colleagues with skin conditions such as eczema, that scaling, and psoriasis that is flared up and it leaves lesions and little breakages on their skin. It is recommended that they practice hand hygiene more frequently, and even before doing that, seek medical advice so they can get these treated. So staff with skin conditions higher risk of passing microbes along each of two patients, and wherever you think it's going to go, the probability arises that it's going to go there. So cuts and abrasion on the hand must be covered with an impermeable dressing when in the clinical environment and when performing clinical procedures, says Northern Ireland Public Health Agency in an excerpt from last year. So drying off the hands, I should have mentioned that before. Drying off the hands thoroughly is also recommended, and then moisturization. So avoid rough, what do we call it, paper towels, because paper does cut. And so I've seen where those paper towels in healthcare institutions actually cut the healthcare worker who is trying to dry her hand. And so with that, we have to be careful. To healthcare administration, when you're ordering these supplies, ensure that they're also safe for your healthcare worker. Keeping nails short. Avoid wearing artificial nails, nail polishes, nail varnish. It's some of the techniques to proper hand hygiene that we so impress upon in the healthcare. From I was going to nursing school, I still have my little student hack that tells you how to groom yourself, what to avoid, and why you should avoid it. And to this day, my fingernails are always short, and I am not very fond of artificial nails, nor nail polish or nail varnish, because I am so afraid, especially when I was in the clinical setting, of transferring microorganisms. Because when the artificial nails crack. When the nail polish cracks, it's a source for microorganisms to accumulate. And then the transference comes so more easily than it would before. And because, say for example, you have the artificial nails on and the microorganisms find itself underneath that artificial nail. Even when you wash with the proper technique, there's a probability that you will not remove all of that microorganism. Hence, you run the risk of contaminating surfaces and individuals, and even more so yourself. So as nurses, piggybacking on most of the things that Mrs. Bates said, because she emphasized that as nurses, it's our responsibility to ensure that we educate, promote, and assist in maintaining these proper principles of hand hygiene. Say, for example, we are healthcare workers out there in the community setting. Staff visiting a patient in their home setting should carry out their hand hygiene on entering or leaving that in the home. So the 5 moments of an hygiene approach should also apply even if we're out there in the community setting, in our clients' homes, and even in our homes. So Northern Ireland Public Health Agency, more than WHO, you will hear me refer to them. They state that in most instances, it will be appropriate to use the facilities within the home, but if it is advisable that the healthcare worker takes his or her own supplies, because then he or she can verify that what is being used is of the highest standard. Because sometimes in people's homes, they water down the hand sanitizer, or the alcohol does not have and so that will be so ineffective. And then the most effective hand hygiene practice in the community, especially in a client's home, would be washing your hands with soap and water. And my mother always say, if in doubt and you're not sure, just do the highest standard of the technique that you need to do in order to achieve the results you want. So patient visitors, we should also impress upon them the need to prevent and spread infections and to teach them proper hygiene practices. I sent my nephew the other day to the bathroom to wash his hands because it was tight. And I swear he took like about 10 seconds to go to the bathroom, say he washed his hands to come back. And I had to teach him proper technique. He was not very happy because he thought that he did it properly, but of course not. So sometimes we have to assist our loved ones, we have to assist the public, and we need to educate and impress upon them how, when, and where to perform hygiene procedures. So even with regards to us as healthcare providers, compliance with hand hygiene, it becomes suboptimal, as I said before, especially in cases where we as healthcare workers, our skin is irritated, or we think using the gloves can curtail some of the steps that we are supposed to adhere to. And of course, because we are so busy and it becomes a continuous routine, we don't pay attention to all the various steps to ensure that it is done properly. So for hand washing with soap and water, 40 to 60 minutes, 45 minutes is what WHO says. And of course, these time constraints with using a hand sanitizer rub. If you do it for less than 20 seconds, it will be ineffective. So alcohol-based rubs should be applied. If you're using that technique for 20 to 30 seconds on your hand, do not wipe off, allow it to dry on your hand. So I'll be looking briefly at some aspects. Hygiene, and I hope I'm not too far gone with the time. So I'll be going very quickly. So when we consider body hygiene from a personal perspective, it can take a wide range of areas such as hair, skin care, foot care, eye and ear care, dental and perineal care. And though it is vital that every healthcare worker meticulously attends these personal hygiene areas, I will focus just mainly on those which constitutes the protocol and the regulations for us who work in the health team. So in the same way we are vigilant about hand hygiene, we should be vigilant about body hygiene also as healthcare workers, because it is also important in the transmission of microorganisms, and it makes us and the patient more susceptible as well to healthcare associated infections. So one study by Dr. Alison Ross and the company from the National Institute of Health stated that their study showed that though nurses knowledgeable regarding the importance of health promoting activities, nurses may not follow these recommended guidelines strictly by virtue of long hours working, work overload, the shift system in nursing practice, running from one task to another, and then of course, family and social life and even academic tasks in their life can also put a stress on and a strain on them paying close attention to these particular aspects of hand hygiene and body hygiene. So one recommendation that Dr. Allison and company made with regards to this finding was that nurse leaders should incorporate strategies into the nursing workplace to improve the health of the staff nurses. Increasing behaviors such as continuous hand hygiene campaigns, remedial training on the appropriate use and selection of PPEs, looking especially at doffing, because that's where they found that most of the discrepancies was being linked to. We know to put it on fine and it is not contaminated when we put them on, but how do we effectively take them off? And of course, our attire and grooming, adherence to wearing the appropriate uniforms and footwear, jewelry, and then other aspects that they looked at were foot care and ventilation. And they looked at decontamination from the aspect of where if you have reached a decontamination level, then you are an expert in infection control, because when you require decontamination procedure, you're looking at situations with smart suits, radio and substances might have come in contact with your protective gear, and so you need to contaminate even before taking those off. So according to one Professor Hillier, and everybody seemed to have been doing their study last year, Florence Nightingale, as far as in 1860, called on nurses to wash their hands and faces frequently throughout the day, reflecting a long-standing recognition of the effectiveness of hand and body hygiene. So what we're doing today is not new. However, we still need to improve it somewhere and make our mark on it so it can effectively prevent the spread of infectious agents. Okay, so Northern Ireland Public Health Agency also jumped on the bandwagon when I their statements. They stated that healthcare workers should bathe daily because when working long and tedious hours, and I said to myself, I know I will not be able to even find one healthcare worker that does not do that. Here in Jamaica, in our hot tropical climate, and the level of activity that we have to do in one given shift, of course. But then they further emphasize that personal hygiene and bathing also is recommended at least every 8 hours, and healthcare workers need to have their bath and change their clothes. And they basically attributed this especially to healthcare workers who work long hours and who do overtime or double shifts, because especially now in this pandemic, sometimes we are in the healthcare setting longer than we would like. And their suggestion is that if you are there longer than 8 hours, you need to take a break, have a bath, change your clothes, and resume. Well, change your PPE as well if you're working in an area that's highly contaminated, and then resume. However, most of our nurses mainly work at 8-shift system. So having a bath immediately on reaching to a facility to do so, or your home would be the most appropriate place. Have a bath before doing anything else. Mrs. Garrick Lloyd was telling me about this advertisement. I think the D&G franchise was advertised in Malta, and they showed the nurse going out to work, and they showed her coming back home and her child hugging her in the uniform that she came home from work in. And then she went and sat on the sofa. Somebody handed her a Malta, and then she went. The clip, another footage where she was sitting at the dining room table with her family in the same clothes that she went to work and come back to work in. No, I'm saying they needed good nursing consultation in order to that was not the point they were trying to bring across. But I know for us as nurses, when we look at that advertisement, that will stand out to us mainly because we ain't looking to drink so much. We're looking at how that nurse may have contaminated her whole household and her family in the event that she was carrying a dangerous microbe on her clothing and okay. When we're looking at hair care also. I remember as a student nurse, my teachers used to tell me, don't ever let me catch you with hair on your shoulders. If you have touching your shoulders, if you have long hair, it needs to be off the shoulder like this young lady here up to the top corner, even though she's of a different ethnicity. So washing of the hair every day was what WHO recommended. But because we, with our Afro hair and the washing every day suffice and would be most of us, I went ahead and I looked for another article. And this young lady, she is a healthcare professional that specializes in Afro hair from Ghana. Study that was done, I think it was a survey that was done last year with regarding to nurses, doctors, and other healthcare workers and hair care during the pandemic. She was a 1 week recommendation for Afro hair would be reasonable. However, if your hair becomes contaminated or there's a probability of microbe exposure, wash your hair immediately. There are principles with regards to hair care and grooming, and I know our institutions have them in our protocols and our policy manuals. And we are told to wear our hair out of our faces, off the shoulders. For men, no extensive facial hair should be groomed adequately. And of course, the ensuring that our protective hair headwear, especially our caps, especially when we are in our PPEs, should be properly placed in the event to prevent any contamination with microbes. It is every nurse's responsibility to know their institution's regulations on attire and jewelry. So hand and body hygiene also involves wearing your proper uniform. And I know that most healthcare facilities have that you wear comfortable fitted uniforms that allow for prevent overexposure of certain body parts. And if you're wearing long sleeve, whenever you're doing your hand hygiene, your sleeves should be over your elbow to facilitate proper hand hygiene procedure and also to prevent contamination of the end of your sleeves. Avoid wearing any form of jewelry on your hand or your wrist, especially those fancy custom-made ones that can trap and become a reservoir for microorganisms. So good footwear also is one of the body hygiene initiatives that was highlighted from the Northern Ireland article. And one foot care specialist stated that for decades, she has seen the ramifications of us neglecting this part of our body. And as nurses, that should not be, because we're always on our feet, we're always on the go. And so that particular part of the body that carries us, we should pay very special attention to it. So when I looked at what she was saying, along with the Registered Nurses of Ontario best practice guidelines with regards to care tips for the feet, they were saying that those tips are not only for the patients, but they are also for the healthcare worker. So tips like wear full shoes that fit well, that support your feet, that are not too tight or not too big, and do not wear shoes that have pressure points that will cause red areas or sores to develop on your feet. And also to keep your feet dry and clean, used water and gentle microbial soaps to wash your feet dry thoroughly between your toes. Moisturize your feet with on-steams, avoiding putting moisturizing cream between your toes, because if your feet in those shoes, more than likely between your toes will get moist, and there's another avenue for microorganisms to develop. And of course, they emphasized going for a massage or doing a pedicure every now and again. Cutting your nails adequately was also one of the things that were iterated. Wearing good support stockings to prevent swelling and to decrease pain of the feet, especially when you're on your feet for so long, was one of those situations that was highlighted. So Mrs. Wade looked at the aspect of PPEs already. So let me move along quickly. Basically, my final slides were handy tips, and they're just little indications that was presented already in the study. And of course, we need to, as nurses, we health workers, we need to keep our knowledge up to date. WHO says hand hygiene education is mandatory with updates every 2 years. I think every 2 years is too long. I am saying like every quarter or as often as you can do it. And of course, emphasizing infection control measures. And if your facility is lacking the appropriate resources to ensure that proper hand hygiene and body care is being practiced, then healthcare facilities, it's their responsibility to do so. So I was telling you about the WHO rolled out with the Save Life Clean Hands campaign. So it is a multimodal hand hygiene improvement strategy, and it's been practiced more than, this was last year, so I know it's more than 350 healthcare facilities in the world. And WHO does a lot of worldwide surveys and they give a worldwide data. So they incorporate the 5 moments. And of course, they look at it from a perspective of system change, where we're available for the staff and proper education, research, do evaluation and feedback to see how effective this particular initiative is, and of course, instituting that kind of culture in your healthcare work environment. So they have various tools, so you could go onto the WHO website and you could just put in WHO guidelines on hand hygiene in healthcare, and you will see a myriad of resources down. You can create your action plan to improve hand hygiene practices in your healthcare institution. You could print them, you could post them in strategic areas in your healthcare institutions. You could give your colleagues their individual copies. You could do practice sessions with some of these tools ever so often. So we can always be keeping abreast and aware of how, when, where, and how effective we can do our hygiene practices to prevent the spread of virus infections. So this is my final slide. It is a map of the world showing all the countries that had signed on the hand care initiative since 2005. And these countries in green, they came on, which was just only 2 countries. I think that's Belgium, and I'm not sure what the other one in South America is. And so the world is embarking on this initiative. Let us heal the world with clean hands. Thank you, ladies and gentlemen. And this is a list of my references. I hope I gave you substantial information. Thank you very much.
Thank you, Ms. Simpson. Colleagues, let us thank Ms. Simpson for soldiering through this presentation, even in the midst of the internet challenges. I would like to apologize to our participants on YouTube, as I know there were some challenges. I do believe it is now back on, and I know for some parts of the presentation, some aspects may not have been very clear because of the transmission, but I hope for the most part you were able to appreciate the presentation. Now, I am pretty sure that when you heard the name hand and body hygiene, you were expecting again to see the procedures for hand washing and taking care of the body, etc. But Ms. Simpson treated us to quite more than that, because we already know the how. We know the procedures, we know the types of how you keep your hand clean, and the type of the type of solutions that we're supposed to use. But she treated us to some of what I would call the underbelly. So what is the impact of not performing adequate hand hygiene? What are some of the reasons? You know, these are probably not things that we possibly think about all the time. And who should really be doing it? In our healthcare setting, we know that yes, the nurses, the doctors, and the physiotherapists, and all the other members of the healthcare team, they are supposed to be carrying out their hand hygiene, but the teachers in the school, students who go to high schools. So now everybody is supposed to be on the proverbial bandwagon to be doing this hand washing. And where, of course, a lot of us are nurses on the platform, so we would have gone to nursing school, or maybe other healthcare providers are with us here, or some of you are currently going to school, and we would have spoken, about where should we be doing the hand washing, mostly in our healthcare facilities. And of course, Mrs. Wade presented the 5 moments, and Miss Simpson also alluded to the 5 moments. But now everyone, everywhere, is being challenged that no matter where you are, you're supposed to be doing this hand washing. She also went through what is one of the major obstacles for hand hygiene in healthcare provider, well, mostly for nurses, and it was time. She looked at also proper skincare. So for us who are employed or who are being encouraged to be constantly washing our hands, what happens to our hands when we do that consistently, and possibly sometimes we're not using some of the correct things that we're supposed to be using, or yes, we might be using soaps that are drying our hands, creating other issues for us. So she spoke about the general care of the skin, and also including something that we don't hear about much, perhaps when we graduated from nursing school, and the council has that first talk with us and they tell you, make sure you bathe and wash your hair often, and that's not something that we get to hear in a presentation every day. But certainly we were given some of the background to that information about how bathing is important. And yes, it might come as a shock to us when they're saying, oh, you have to bathe every 8 hours, or and we were thinking, what? Of course, we bathe all the time. Yes, but in some of these other cold countries, you might be surprised that probably don't bathe. I mean, we do it a lot because we're hot and we sweat and we want to feel fresh and clean. But of course, there are other reasons for bathing, certainly from a healthcare perspective, and how we clean our hair, our feet, how to care for our feet as we go about to give our nursing care or healthcare, depending on the profession that you're in, and how we care for our nails. So we really want to thank Ms. Simpson for that presentation, where we looked at some of the things that we don't get to look at all the time when we are talking generally just about hand and body hygiene. So we are now about to go into our question and answer segment. And I just want to make sure that I am going to give a little bit of information here to those individuals on YouTube. So if you're on YouTube and you did not sign in using your correct name, using your name, sorry, not your correct name, using your name, we're going to ask you to just write your name for us in the YouTube chat so that we can make preparations for your certification. And also, if you had questions but you did not write them, I'm going to ask you now to write your questions in the chat, as I now invite the 2 presenters to be on standby. I think I'm going to be getting some assistance with the questions. Madam President or Madam Treasurer, is there anyone who is going to assist me with the first question? So I'm ready. I'm opening the floor for the first question. We are thanking our presenters very much for their presentations, and I am now opening the floor for questions. And
thank you, Ms. Walker. You may go ahead and see if there are any raised hands while I will transfer the questions from the YouTube. And
yes.
Ms. Sylvia will help you with any questions in the chat over on this side.
Thank you so much, Madam President. Okay, I see Dion Richards. Dion, please, you may go ahead, open your mic and ask your question. You may address the person that you would like to answer your question.
Okay, thank you very much. Good evening, colleagues, and excellent presentations, colleagues. I would have raised these concerns in another forum. So if you have heard them before, please bear with me, but it's something I'm very concerned about. So I'm going to comment again. Well, in terms of the hand washing, when I was going to nursing school, I was also told that when you're rinsing, you follow the same steps as when you're washing, because sometimes the soap you're using, just rinsing it on, just running your hand under the water will not effectively remove the soap residue, and soap residues can trap microbes. So it is best to apply some friction when you are rinsing also. So it would be good if you could comment on that, because I don't hear it being said. I don't hear it being promoted again. And from my own experience, I realize that sometimes the soap suds gets trapped between your fingers. All right, the next one quickly is sneezing into the elbow. I know it is coming from WHO and I know and CDC, but from observation, and I'm sure you'd have observed it too, and from other studies, we're realizing that sneezing in the elbow, even though it is much better than sneezing in the hands, it's not as effective as we are suggesting, because it is not effectively done. And the force at which a sneeze propel the germs across the environment, the sneezing in the elbow may not be very effective because it doesn't cover the nose and the mouth adequately. And so even if, when we're promoting this, we need to teach people how to effectively sneeze in the elbow and the, yes, I personally, I suggest they open the top of the shirt and sneeze in that if they can't do any better. All right, and I'm happy you mentioned the washing of the hair because within the practice now of using hair gels, especially on our Afro kinky hair, I am thinking that when we're walking around on the wards, it's going to trap microbes. And I really think that after every shift, when you get home, you should wash your hair or cover your hair before you go to bed if you're not going to wash it, for obvious reasons. And I am hoping, last comment, I'm hoping that you would see to making a presentation on environmental hygiene, because I don't think we're addressing that issue very much, and our porters, our ward assistants are not benefiting from this kind of discussion. And environmental hygiene is very critical. When you go on some of these wards and see them throwing up the curtains, all right, and they don't change the curtains as often. And when you see how they keep the client's bedside and all of that, and that too is contributing to the spread of the microbes. Thank you very much. Yes.
Yes, thank you very much, Dion Richards. I am not sure if any of our presenters would like to make a comment based on what Ms. Richards said. Mrs. Waite, you could go first, and then Ms. Simpson, if you want to add any comments after. Go ahead, Mrs. Waite. Mrs. Waite, we're not hearing you. Well, I could see your mouth moving saying, are you hearing me now? But we're not hearing you. We're not hearing you, Mrs. Waite. All right, let me see if I can go to Miss Simpson and see if you can get some assistance. Miss Simpson, you might go ahead and make a comment first while Miss Waite tries to sort her situation.
Are you hearing me, Miss Walker?
Yes, we can hear you, but I'm going to suggest, Miss Simpson, again, that you turn off your camera.
Okay,
yes, we know you want us to
camera.
see your face, but it does use up quite a bit of the bandwidth, and it is disturbing the fluency of your presentation. We don't mind. We understand for now that yes. Go ahead, Miss Simpson.
Okay, Miss Walker, thank you. And thank you, Nurse Dion, for your comments. I'm not sure there was a question in there, but I do agree with her. Even when I was a student nurse, I was never in agreement with the coughing or sneezing in your elbow, because that's you transferring microorganisms onto your skin. And sometimes it's funny to me, you see people coughing or sneezing in their elbow and there is no it's just the bare skin. And I'm like, okay, how is that much more effective than coughing into your hand? Because then bare hands, palm fingers, yes, they do transmit microorganisms more readily, but microorganisms can also be transferred via touch from any other surface on your body. Because Miss Walker, you know how we at UWISN sometimes we like to hug. If I just sneeze in my hand and I'm wearing a short sleeve and I come and, hello, Miss Walker, and hug you up, where you think that is going to go?
Yes.
So I've used the sneezing in your shirt, the neck of your shirt technique a lot. And I find that that is a little bit more effective. I thank Dion for across the whole repeating the technique when rinsing your hand, because I have questioned it also, but somebody once told me, this is via word of mouth, so I'm creating an individual statement, that the procedure is not necessary when rinsing because the solutions to wash hands have changed. So gentle, mild, hypoallergenic antimicrobial soaps don't readily leave that much residue on your hand, so it can effectively be removed if you rinse your hand appropriately. So the repeating the technique, that was their explanation for not having to go it over when you're actually rinsing. I'm not sure if Ms. Dion had any more comments, and I do agree with addressing the environmental hygiene aspects. It is very much so needed. So that's probably another aspect that we need to look at. So Dion, thank you again. Thanks again, Ms. Walker.
Yes. Mrs. Waite, I would like you to open
Can
your
you
mic.
hear me now?
Yes, we can hear you clearly. Wonderful. You may go ahead.
My ceiling fan was on the entire time, so they might have just thrown my voice somewhere else.
Okay. Yes, you
Thank
may
you,
go.
Ms. Simpson, for, thank you, Dion, for the comments. And thank you, Ms. Simpson, for adequately addressing them. I too want to also add, as it relates to the environmental hygiene and the other members of the healthcare team who can benefit. I will just say that I understand the concern that Dion has, but like I mentioned before, if we do have healthcare administrators here, it is also their responsibility to ensure that when they are conducting training, retraining, webinars, seminars, workshops, etc., that these other members of the healthcare team are also included in any discussion that they're having, because they are an integral part of the healthcare team, so they should be included. Thank you.
Thank you, Mrs. Waite. And I also wanted to make a comment about the changing of the curtains. Yes, in terms of the training for the assistive personnel, in terms of how curtains are handled. But I do believe that the nurses on the unit are the ones who would organize things like the changing of the curtains, and talk with the personnel about how the bedside area is being cared for, even if they're not doing it themselves, but certainly talking with the lady who comes to clean at the bedside, or if it's a gentleman, because they have different people doing the jobs. But some that nurses, I know it's a lot of work for nurses to do these days, but certainly in terms of the organization of the environmental care, certainly the immediate environment of the patient, which is right by the bedside tables, and to ensure they're not dusty, and how the cleaning is organized, etc. And the changing of the curtains, because I'm sure it is more the nurse that is organizing some of that, and I could be corrected where that is concerned. I'm not necessarily sure that it's the porter that's coming to change the curtains. It's the nurse who would order the changing of the curtains. Yes, not so?
It's as far as we are aware, it is our nurses and our nurse managers in particular,
Yes,
who are in charge of our healthcare units, and they are responsible for these things. As it relates to how often the curtains should be changed, once they are visibly soiled, they should be removed. Even if you put them up yesterday and they become visibly soiled, they should be removed immediately. And as it relates to if they are not visibly soiled, I am saying that you also have infection prevention control departments and personnel. Get input from them, get
yes,
information from them, collaborate with them, and they will help you to determine how often it should be changed. It depends on a number of things. We
yes,
can't sit here and say we need to change it every week, every 2 weeks, etc. It depends on a number of things. It also depends on the unit in which these curtains are situated. So work with
yes.
your infection control department, and they make the relevant changes as necessary.
Yes, I was actually thinking, Marvet or Carlene, I was thinking of curtain swabbing. I don't know if we do stuff like that, like take swabs of curtains, you know, in it to see, for example, which curtains, if the curtains at the front of the ward, or if they have more organisms, or if the curtains in a room, you know, things like that. You know, I mean, that might be going a little bit above and beyond, but certainly in one of the presentations, in a presentation I had seen earlier, where they did swabs of a person's bedside, and it was looking at all of the different, certainly, for example, in an area like ICU where they have lots of machines, and they took swabs of the different things that were by the patient's bedside, and you know, they realized that they were fomites. You know, the bedside table, the machines that they had, the blood pressure machine, the map machines that they used to look at the patient's cardiac rhythm and all of that, and they were all fomites. So I'm thinking swabbing curtains could also be included if it is not already included.
And may I just add to
possibly
Ms.
aid.
Kappa, it is also important that we also consider the kind of material that we use for these curtains
Yes.
and screens.
Yes.
So that is also a part of administration's role and responsibility.
Yes, and this is an excellent point to segue into this question. I'm going to take a question from YouTube. This question is for you, Mrs. Waite, and it says, how frequently should the partition curtains between patients be changed? Okay, I think you might have answered it before, but if you want to reiterate your response.
Yes. As soon as they become soiled, if they're visibly soiled, change them. And especially we know that in most of our healthcare units here in Jamaica, we use a lot of fabric partitions. If you do have the ones that are not, if they're almost like plastic, then those using the right kind of solution can be cleaned and cleaned quite often, especially when they're visibly soiled. It should be done immediately. And like I said before, determination in terms of how often you change those and how often you clean them if they're not visibly soiled will be the work of collaboration with your infection control department.
Thank you so much for that response.
You're welcome.
I have another question from YouTube, and I would say I will read the question, and Mrs. Waite or Ms. Simpson, you can indicate if you want to respond. It wasn't directed particularly at anyone. It says, how often do you use hand sanitizers, and after how many applications do individuals wash their hands? I find that some hand sanitizers can be a bit sticky on the hands. I'm not sure who would want to take that.
I
can
start. Yes, thank you. Thank you so much, colleague, for that particular question. I will start with the last part. You do find that some hand sanitizers are really sticky because since this pandemic, we find that persons have their own formulation for creating their own hand sanitizers, and some hand sanitizers are not even recommended by the appropriate agencies. So we have to be mindful first of all about selecting the kind of hand sanitizers that we use. There are websites that you can find a list of approved hand sanitizers. And with that said, I'll move into the other part of the question that asks about how often you should use hand sanitizers. Remember in the discussion we had earlier, and Ms. Simpson even alluded to it, that if your hands are visibly soiled, you should be using soap and water. Hand sanitizer should be used or to be selected if you do not have running water and soap available. And that is why I implored our healthcare administrators to ensure that all of these equipment, so to speak, are available for healthcare workers to use. You will use hand sanitizers if, for example, you are removing PPE, your PPE are not visibly soiled, or if you feel that you have been contaminated by them and water in the space, you use your hand sanitizer until you are able to find soap and water and you utilize soap and water. Hand sanitizer should not be used to replace soap and water, is what I'm saying. And if you're not quite sure, and you also should be reminded that you should follow the guidelines as stipulated by your healthcare facility. Don't go and tell them, Mrs. Wade, say you have to wash your hand after whatever you do. But be mindful, bear those in mind to follow the guidelines set by your healthcare facility. The other part of the question is asking how many applications do individuals use in terms of hand sanitizer before you wash your hands? I would say that do not substitute hand sanitizer for hand washing if you do have soap and water available. If, for example, you're at a patient's bedside and you are doing a number of tasks for the patient, you do not have hand washing station at the bedside, then you can use sanitizer. But as soon as it's available to you, you go and you wash your hands using the soap and water.
Thank you very much for your response, colleagues.
Ms. Walker?
Ms. Simpson, I will give you 1 minute to make a comment.
Okay, I
Go
just
ahead.
wanted to add that I was looking at a report from the CDC, and they said hand sanitizers should only be used in instances where the probability is very low that you had contaminated your hands. So if you find that you are using hand sanitizers too frequent for comfort, it is time to wash your hand.
All right, thank you very much for that very important point. And with that, I do not see any more hands. So I am assuming that everything else is clear. I just want to make one comment from the chat where Andrea was indicated, remember no hugging, it's a pandemic. And I think that was in response to Ms. Simpson when you said, if you sneeze in your elbow and then come to hug me, then I am going to get all the germs from your elbow. And Andrea is saying, no, 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 Miss Walker shouldn't be getting any germs from your elbow because you shouldn't be hugging her anyway. Thank you, Miss Watson, for that. There was a last question
Ms.
I see
Watson,
here
that
in the
was before
chat.
COVID.
Yes, that was before COVID. We barely even see each other now anyway. Miss, I think there's one more question. Anybody can respond. It says, are BP cuffs ever cleaned and alcohol swab containers? Is there a protocol for cleaning them? Who wants to go first? Simpson, wait. And we are going to wrap up with this question.
Very quickly, blood pressure cuffs should be clean. And it's like we mentioned before, we're in a pandemic, and especially if you have clients who are you are using contact precautions for, then those patients should have their own equipment in terms of blood pressure machine, your stethoscope, etc. But as it is now, if it is not for contact precautions, your blood pressure cuff, they can be clean because the kind of material that makes the blood pressure cuff allows it to be clean and to be sanitized. Alcohol swab containers, you have to find out from your infection prevention control department. They usually do swabbings of these equipment within the healthcare environment and decide how often they need to be cleaned, to be recycled, or not to be recycled, to be discarded, etc. So I would ask that you contact your infection control and prevention department and be guided by the protocols that they will tell you.
Yes, thank you. Ms. Simpson, did you want to make a comment? I'll give you a minute.
I was just going to add something that most of these equipments are manufactured overseas. And sometimes the cleaning regulation aspect of it is given to the environmental department. However, our nurses leaders can take the initiative to ask for these cleaning instructions, to incorporate them into the nursing regulation aspect. Even if we're not the ones who are doing the cleaning, we are responsible for ensuring that it is done effectively and with the proper equipment and solutions as not to damage these equipments, blood pressure cuff included.
Yes. Okay, thank you very much. I am going to say my last piece, and then I'm going to hand over to our president and allow her to do her presentation and take us out of this meeting. Colleagues, all, thank you so very much for joining us in this, our second set of presentations in our infection control webinar series. Please, please, please feel free to join us next week as we have 4 more. I was going to use exciting, but I will say invigorating topics. We are going to be talking about high-level disinfection. Yes, that sounds so awesome. Sterilization. We're going to be talking about food safety, and we're also going to be talking about the role of nutrition in infection prevention. And these presentations, the first 2 will be Monday, April 19th, and the other 2 will be Wednesday, April 21. Please Register, pay your registration fee, and join us. Thank you all so very much. It has been my pleasure being your moderator. Please hold on as our president of the Omega Kappa chapter will come and do a small presentation. Please join me in thanking our two presenters for the very comprehensive presentations that they gave. And I'm sure, like myself, you learned. Thank you all so much, Madam President. I will now hand over to you for the final words.
Thank you so much, Ms. Walker, our moderator. Thank you very much to our presenters, Mrs. Wade and Ms. Simpson. The internet was trying to not favor us today, but we have made it right down to this point. And so I really thank both of our presenters. Thank so much all our colleagues who joined us here on Zoom and on YouTube, because I know there was a little bit of a challenge at the beginning with the technology. Thankfully, we're able to hopefully have resolved it quickly, and that we hope that they have benefited greatly from these two presentations. And I just want to add one small part before I talk, that we do have another infection control session on Friday, Ms. Walker, next week on the 23rd. That's the last of the infection control sessions on infection prevention and control. So the registration link is closed for today, but reopens tomorrow morning to facilitate registering for next week. So in closing, I just wanted to say we are the Omega Kappa chapter of Sigma Theta Tau International Honor Society of Nursing. Yes, it's a mouthful, so mostly we just say Sigma for our parent group, and we are the Omega Kappa chapter. Now, I do want to apologize to the persons who were not on the YouTube at the beginning, because we had a lovely brain teaser, and because they weren't on, I think it would be unfair to announce the winner. So I'm going to quickly scroll past it, and hopefully we could use it again. So just a little bit about Sigma and Omega Kappa. In 1922, they had 6 nursing students in the US who wanted an activity that would fit their training in nursing, and they were brave enough to create Sigma Theta Tau International Honor Society of Nursing. Our Greek words are Storch, Tarsos, and Time, which means love, courage, and honor. And our headquarters of Sigma is in Indianapolis. Our vision in Sigma is that we want to have connected, empowered nurse leaders who are transforming global healthcare. And our mission, is that we want to develop our nurse leaders anywhere in the world to improve healthcare every single where that healthcare can be improved. And so if you want to join, you're eligible to do so if you're a nursing student or a nursing leader. And we just want to highlight how you'll be able to. Just a quick note that we have about 135 plus active members across 100 countries. And though we are chapter 560, we have approximately 540 at this time active chapters. So if you're an undergraduate student, you must be in a bachelor's nursing program or the equivalent, then meeting the criteria for academic excellence as set by your institution, be in the top 35% of your nursing class, and you need to have completed at least a half of the curriculum. If you're transitioning from RN to BSN, then you must have completed at least 12 credits. And if you're a graduate student, then we want you to have completed a quarter of your curriculum, and you're also meeting the academic excellence standards and meeting the expectation of academic integrity. For our colleagues who are already nurses, you're a nursing leader, we want you to be legally recognized to practice in your country, have a minimum of a BSc or the equivalent in any field, and demonstrate your achievement in nursing to us. And so in Sigma, across all chapters from all of us, there's the opportunity for career mentorship, professional development courses, a very large e-repository of resources from research to documents and other information, for networking, for volunteering, and we have a whole host of webinars and conferences. This is our Omega Kappa chapter being chartered in May of 2019, and we are currently geographically at the U.S. School of Nursing. However, our membership spreads across Jamaica, Trinidad and Tobago, the Bahamas, the US, and the United Kingdom. And we do have nursing students and nurse leaders in our chapter. Just sharing a little of who we are and what we've been doing. This was us at convention in 2019, bearing our colors and our flag. This is us on the right. We participated in the Guardian 5K, participated in International Coastal Cleanup Day. This was our chartering day, and these were some of our then nursing students who are now our nursing colleagues. We have a webinar or a session every World Mental Health Day on October 10, and an annual health fair for our primary school and our special needs school in August of every year. We had a little feature on the radio and the television, and we had a webinar series, the first one last year. And if you want to find us, well, if you want to find Sigma first, you could just go to Sigma Nursing and you'd find the website. To find Omega Kappa, you type in omegakappa.sigmanursing.org. We're on Facebook as Omega Kappa Chapter, and we're on Instagram as Omega Kappa Caribbean. And of course, you would have all gotten our email address by now. So we encourage you to let us know, or we take volunteers to participate in any of our activities, whether you actually want to join us or not. And so I remind you, as I will for each session, Maya Angelou says that they may forget your name, but they will never forget how you made them feel. Let us empower ourselves to be the nurses. Our clients will remember the way that we made them feel. Thank you so much for joining us today. I just want to ask you to just send out a small reminder to your colleagues for me. I know they're looking out, and some people may have been a little disappointed they weren't able to join us today, that we do have to do a lot of behind the scenes processing. And so on the day of the webinars, we would not be able to facilitate a lot of the other activities. And I'm pleased reminding you, ask your colleagues and yourselves, please just read the details of the registration information, because we're seeming to have a lot of miscommunication regarding the receipts to be emailed, how to get into the YouTube sessions, how to join via the Zoom, and to ensure that we are writing our names to record our attendance. The only way to get your certificate with your accurate numbers is if we're able to actually record your attendance. So look out for the flyer with all the speakers and the topics for week 2. Again, we'll send the registration link, and we will see you next week, Monday, Wednesday, and Friday to close out the infection control part. And we'll see you the other week for awesome non-nursing topics, looking at online platforms and online etiquette, and looking at wealth management. Have a very good rest of your evening, everyone.
Thank you for joining, colleagues. Thank you.
Have a blessed evening, colleagues. Take care.